3, 2, 1.
The new facility has almost everything that we need. Ventilators, monitors, high sophisticated monitors, and a very dedicated bed. Top of that, we're going to have the other system, which is a high flow. It's a way of delivering oxygen to the patient with a smoking issue. Burns has many complications, and one of the complications is infection, and an infection can lead to kidney failure. So you need the dialysis machine, and we have 3 dialysis machines on the other side. I think that would be enough to deal with this type of complications. So having one theater was a big challenge because you have to do everything there. Children, adults, it means that you have to clean and wait for the theater to be ready. Now we're going to have a second theater dedicated only for burns. It means that you're starting in the morning, you're finishing with burns. 80% of patients will die because of infection. So having theater, you cannot pretend having a burn center if you don't have facility or access to theater.
So the Center of Excellence will have a significant impact in our ability to provide essential, life-saving care to the hundreds of severely burned patients who rely on the public health system for medical care.
A bigger burns unit with more ICU beds, a second theatre, and additional ward beds will do us great, both for, I think, the community at large, the country, and the whole of Gauteng.
This unit, you know, yesterday there was another incident of burns in Johannesburg. Last year there were all these people who were burned, and the professor who's in charge of the burns unit also mentioned that many of them were treated here. Many people are going to benefit from your generosity, receiving the best care that they can get in the Southern Hemisphere and in Africa. Thank you very much.
As a staff member in the new ICU unit, I'm expecting better care for our patients, short stay in the hospital, and hopefully, I don't know, less admissions maybe.
Prevention comes on 3 levels. The first one is to improve people's life, because we always say that burns is a disease of poverty. And we've seen some improvement. I can tell you, like the Prama stove explosion were improved, came down because of electrification of many parts of Soweto and so on. And the second line of prevention is whatever we do, burns will happen, but you need to reduce the risk of these burns to complicate. That's the second way. And the third way is prevention of mortality. So burns will happen to you, will happen always. So if burns happen, you need to prevent mortality. And this facility, it is exactly the way to prevent mortality.